Hello and welcome to the Autistic Me podcast. I'm Christopher Scott Wyatt, and today I'm being joined by Daniel Sansing, a university instructor, tutor, neurodiverse parent, and neurodiverse individual. We are going to discuss the value of and the risk of disclosure. Welcome to the show, Daniel.
Hi, thanks for having me.
I know that one of the reasons disclosure is interesting to you is you were recently diagnosed, relatively speaking, and are now navigating to whom and when to disclose your autism diagnosis.
Yeah, I think it was a long process for me. I know that I'm not alone in that. I think a lot of folks are being diagnosed in middle age, but my first diagnosis in 1991 was schizophrenia, which got changed to bipolar disorder, which got changed to, I think I heard like seasonal affective disorder. I heard just depression. I was referred twice for ECT, but thankfully I didn't do that because I had, some football concussions in high school. I thought that would be a bad combination, and I wanted to keep all my memories. And then from that, then through the years, I finally got an ADHD diagnosis in 2013, and then in 2017, last fall, I finally got an autism diagnosis, and it was kind of a no-brainer based upon the results that the screener got from 3 hours of testing and a couple of questionnaires that my wife and I filled out.
And obviously, your wife was along for this journey through diagnosis of autism, so she obviously was disclosed to immediately.
Yeah.
Did you disclose to extended family and your children when you received the diagnosis?
I did. I think most of my friends were not surprised. My family was probably not surprised. People who've known me for a long time and are close enough to me to know me well were not surprised, and I got a lot of support. And I even posted in Facebook. I posted, I guess, a couple of months ago that I wasn't going to be afraid of who I am anymore, and that I felt like it was sort of my responsibility to disclose. So I've kind of flipped that around, and I no longer feel like disclosure is really just about me, but it's about making autism normal, because it's really not that big a deal. It's just like any other health problem, and I hope that people can get educated enough that they can understand that difference is okay, and if I need to wear headphones at work, that's cool.
Now, when you say that autism is okay, some of us have found that disclosure is a complicated and risky endeavor. Even with friends and family, there are misconceptions and confusion about what constitutes autism, and doubts about whether or not a supposed high functioning, a term I find problematic. So much language with autism is problematic, but they assume that a high functioning individual cannot be autistic.
That kind of speaks even to my screening and diagnosis last fall. Doctor, I won't give his name here. I don't know if he would want me to, but the doctor is a psychologist who had actually works a lot with children and had been at Children's Hospital before he opened his own practice. Now he's got, I don't know, maybe 5 or 6 counselors working under him, mostly with children there. He said, you don't fit career-wise. Like, I'm not supposed to be good at language and communication, but my grandmother taught me to read when I was 4 before I started school, so I could read when I started kindergarten. And I've also worked in highly verbal careers. I spent 4.5 years as a newspaper journalist. I think that really kind of pushed me into a much more social mold. So I can function very socially, even if it's exhausting. And at the end of the day, I just kind of close myself up in a room. But there's still sometimes the feeling of somebody's not going to believe me. They're going to think that I'm not like these folks who exhibit all the time and who exhibit clearly autistic symptoms. But I'm just a damn good actor. That's the way I look at it.
One of the things that I dealt with in the last few days was a parent who did not want the autism label for a child in the K-12 setting. And the reason I consider this important is the Individuals with Disabilities Education Act, of the 13 categories that are listed for supports, one of them includes autism and neurological challenges. So the school is trying to provide supports, but in this case, the parent is resistant because the autism label carries a negative connotation to parts of our public.
Well, and the autism community can also be resistant to that label. But there was a speaker who, this was at a graduate student conference I attended a couple years ago, who was openly talking about her autism and about supporting those students and about the problematic nature of labels. But she agreed when I told her that we couldn't get services for our son without the label. So it doesn't matter if it's PDD, NOS, or ODD or ADHD, but you got to have something for the 504 and the IEP if you're going to do those things. So, gosh, labels are problematic, and there's a reason why we have discomfort with those, because all diagnoses are social constructs, and we're just doing the best we can with what we've got and trying to describe what we have. But of course, reality doesn't fit in nice, tidy boxes, and it's not simple binaries. And we're always going to struggle, I think, when things are more complicated than we want them to be.
One of the things that disclosure does do is help those around us understand some of our quirks and differences. It's one thing to be considered the awkward or geeky individual. It's another if you can sit down with someone and say, I have processing issues. I have these other issues that are affecting me socially.
Right.
How do you approach the idea that disclosure helps explain to people their initial discomfort?
I'm going to go all the way back to high school, where one of my English teachers and my drama coach um, told me that our head football coach thought I was flaky. Like he said, I was quote unquote flaky. Um, I think he was trying to describe the difference that I am, but he put it in sort of good old boy, coach terms. I think I confused him. But now looking back, I think my coaches might even feel some guilt knowing that they were running somebody out onto the field, even when I was a 14-year-old freshman, um, you know, to get head injuries, who had a disability. Um, it's I think it helps people, but it's only going to help insofar as they're willing to understand.
What about the part of the population, especially in employment circumstances or dating circumstances, that has a fear of the word autism or the label autism?
Well, I think it's going to be tough to date openly. Um, and it seems to me that a lot of the high functioning students that I see on campus they want to date neurotypical students. People like well meaning teachers or counselors or whoever will push them toward other students with autism, but they don't want that. They want what they want. And I think it's really difficult because somebody's going to know, and they're going to know pretty quick, and you're probably not going to go more than a couple of dates and somebody's going to know that you're different. And if you don't disclose fairly early on, they're just going to think there's something odd about you. They're going to get kind of a weird feeling and they're going to move on. So I think in a lot of ways we have to disclose. Um, I would say it's been more successful for me to disclose than not to disclose, because otherwise I think people just think I'm kind of weird and I make them uncomfortable, but they can't exactly put a finger on it. But they're like, well, he's got a lot of charisma, but he's different. And I think that's, it's a catch-22.
And this is true in the social aspect of employment because workplaces in many ways resemble dating. They're trying to find out if you have similarities. How are you going to fit in with your coworkers? Do you have the same cultural values, the same interests? And so not disclosing in a workplace can be as problematic as not disclosing in a dating relationship.
I think that I work in a very open and supportive department right now, and we have a lot of neurodiversity in our writing center. Um, so I think that I'm lucky in that regard, but I was not chosen for a lab manager position that I interviewed for that I thought I was a strong candidate for. And I think there was probably either overt or unconscious bias maybe involved in that decision. Um, I thought I was a really strong candidate, and I think it came down to personalities or people's perception of personalities. Um, I think that I could be a strong candidate for a lot of jobs, but I now feel like I have to disclose because I've gotten phone interviews. I think, well, maybe I talk too much, maybe I talk too much theory. Sometimes I have trouble connecting with neurotypical folks in terms of I'm high theory all the time. That's all I do. That's all my mind does, but that doesn't necessarily translate well to your everyday folks who are trying to do a committee meeting, job interview. Um, but I'm always in that world, so it's hard for me to connect to people who don't think in theoretical terms all the time.
And in terms of disclosure, I increasingly advise students that they need to decide which faculty members should or shouldn't be told based on, in some ways, the impression they get from that instructor. Will that person be supportive, or will that person now use your disclosure as an excuse to penalize you? And unfortunately, that does happen in education and in the workplace.
I would probably tell students to err on the side of disclosure and to use it as a protection. Because I think there'll be, whether unconscious bias or just downright prejudice, you're probably going to see that from instructors. I'm an instructor myself. I really encourage my students, even if they're not going to ask for accommodations, to have something on file with disability services because it makes it so much easier to get a process going if there are problems. As a graduate student, I would disclose to all of my professors my neurodiversity. I would do that at the beginning of each term. I didn't ask for any accommodations in any of my classes. Sometimes they granted me an extra day or two for a project, but that was case by case and not that common. But I was on file with disability services in the program that I was in, and I think that was sort of a safety net for me. It was something I could fall back on if problems arise, and when the stress hits, they always do arise. So I would probably advise students to have something on file with disability services, accessibility resources, whatever the title is on that particular campus, because it's a protection, and you do have federally regulated rights, and you need to be your own advocate because people aren't just going to be nice to you, and some people don't just do the right thing because it's right. They do the right thing because they have to.
And I think that it's important to distinguish that when you disclose to disability services or the disabilities office on your campus, that is offering some protection, especially with ADA accessibility in settings. But disability services may or may not then disclose to specific professors based on the course content and the course structure. So
I think our students are. Oh, go ahead.
Registering with disability studies is something I think students should do as they enter an institution, and then listen carefully to the disabilities advisors who hopefully know each program and each professor. Maybe not each professor individually, but they have a sense of what is or isn't anticipated and accepted in terms of accommodations.
Right. I just, especially if they're asking for accommodations, I would, um, I mean, our campus, I think, has shifted and improved, and we've just recently rebranded with the term accessibility instead of disability, which I like. But I, I guess it's always risky, but I would say you're better off, especially if you need accommodations, get the accommodations because college is stressful for neurotypical students. I see them melt down, and I have tissue on my desk in the writing center just for that. It happens to everybody. The stress gets to everybody, and stress tends to make neurodiverse issues more severe. So, wow, I think it's risky, but I think that students are also, in a way, advocating for other students by disclosing and by advocating for themselves.
Let's address one aspect of disclosure that we've talked about, and hopefully we'll be talking about in the future to academic audiences, the exhaustion that results when you don't disclose of having to mask or act or in other ways assume normalcy.
Well, I think there's a performed self for. Oh, I mean, I think this is true of neurotypical people as well. We all have kind of a performed self, but there's less difference between how those folks are at work and how they are at home. Um, we talk about professionalism and behaving professionally and all these kinds of things. And I think sometimes it's even more difficult when you have neurodiversity in terms of what you have to do every day. And at the end of the day, sometimes I'm so exhausted, I just go to the basement and hide. Um, and I really don't have anything left for anybody else. So I just hang out in the basement and try to decompress because it's a real cost. I think a lot of it has to do with sensory processing disorder for me and just the sensory overload of really busy work, seeing students all day, teaching class, whatever it is, um, that I'm exhausted from that performance. Um, so I think it really takes a toll. And if you are concerned about people, say, seeing you look different or act different, or you're not open to wearing headphones or having some other kind of sensory filter at work, then that's going to make it that much more difficult.
One of the things that I find problematic is when coworkers or academic advisors will say, everybody has to act. Everybody has to put on a jacket and tie, and that's an act, and nobody likes it. Everybody has to speak in a specific language, especially in academia or business. And my response is that is very different to put on a tie than to hide your emotions, hide your language, your tone. You're asking for a core change, not a surface change of the autistic individual. And I
I
think
think
there's a
that's also
difference.
Yeah, I think that's also true in publishing. I felt like a lot of the things I tried to get published in the past that I was get hit in the ivory tower. Um, but NCTE and I think 4Cs as well. They've drafted these rights to your own language kinds of statements. My language is different. I know it's different. I use big words. My buddies would laugh at me because I was using big words as we're sitting in the bar having a beer. Um, but I know I think differently, I speak differently, and I write differently. And I finally feel like I'm getting some recognition and some praise, and that people are seeing the the way that I see is becoming more clear in my academic writing. But it's taken a long time to get to that point. Um, as far as the performance at work, I mean, I have a teaching persona. I think that it's to the benefit of an instructor to develop a teaching persona, but mine's probably even more developed and delineated than what your average professor is. But I've always preferred a professional distance. I still call my former instructors who have told me numerous times to call them by their first names. I still call them Dr. So-and-so. So I think that's just part of who I am.
When we talk about disclosure in the workplace and public disclosure, you said you posted to Facebook. You do have a blog. You're obviously appearing on the podcast and hopefully a potential academic panel or two. Putting yourself out there as an autistic individual, how does that change the dynamic for you of accepting the diagnosis and who you are?
Well, I think that I tend to beat up on myself a lot. And if I publicly acknowledge my difference, that I think it's easier for me to cut myself a break sometimes and say, hey, this is part of what I'm dealing with. This is part of who I am, and I don't have to be so harshly judgmental on myself. I think that I have very high standards, and I worry sometimes about my children, and I think my students get the best of me. I don't know that my children always do, and I can be very exacting and very I have high standards. I mean, the highest of all for myself, but I tend to push a lot and push myself a lot. So sometimes I think I project that a little bit, but it's helpful to me to be able to say this is who I am, because you can't just beat yourself up all the time.
What about the risk of disclosure that people will judge you with the label and not get to know the individual Daniel?
Well, I don't know. I'm kind of a big guy, and I'm kind of like, I think I have a bit of charisma to me, so I think that that's helpful. I can win people over. I can sell things. I can connect with people in ways that they didn't really expect. So I think that I do sell myself well in that way. But I think I'm not too worried about the folks who, if they're just going to look at a label and not look at who I am. I don't think I worry about that too much anymore. Maybe I did when I was younger, but now I'm just like, whatever. You can't change everybody. Sometimes you just have to let the dead bury the dead.
I want to thank Daniel Sansing for joining us on The Autistic Me and lending his voice to a discussion about disclosure and how that may or may not affect our relationships and workplace environments. Daniel, thank you for joining us on today's episode.
Thank you for having me.